Hello. Several years ago, my mother was diagnosed with lung cancer, and one of the side effects of her treatment was a significant peripheral neuropathy, which was problematic for me because that was something I was already interested in, something I was already trying to find solutions for, and it became a huge problem. Did you know that cancer is one of the big causes of peripheral neuropathy? It can cause peripheral neuropathy itself. For example, if you have spinal cord or brain type tumors or cancers, or even cancers of some of the nerve cells like the Schwann cells or something. Any cancer in any of these areas can actually cause nerve damage and cause a pretty significant peripheral neuropathy. The other problem, however, is that a lot of the treatments, many of the treatments can cause pretty significant peripheral neuropathy. For example, some of the chemotherapy type treatments are neurotoxic, and 90% of these neurotoxic type treatments cause peripheral neuropathy. But in my mother's case, it was radiation that caused peripheral neuropathy. So radiation can cause it. Chemotherapy medications can cause it. Even cancer itself can cause it. So how would this present if you had a peripheral neuropathy from cancer? Well, in fairness, it's not going to be a whole lot different than everything else. For example, you could have damage to the sensory nerves. You can get tingling, numbness, pins and needles. You can get inability to feel hot and cold. Inability to feel pains. You get cuts and you can't tell. What about motor nerves? So if the motor nerves are damaged, you can have weakness or achy muscles. You're going to have muscles that twitch or cramp, or muscle wasting, which is decreasing the size of the muscles. Swallowing or breathing difficulties. In my mother's case, one of the things that happened is she was unable to swallow, and it made it really hard to eat. Damage to the autonomic nerves can also be a problem. The autonomic nerves also make up part of this, and they're the nerves that primary functions such as blood pressure, digestion, heart rate, temperature, urination. So if you get a digestive change like constipation or diarrhea, that may be an autonomic peripheral neuropathy. Dizziness or fainting from low blood pressure when you stand up. Sexual problems, sweating problems, either too much or too little. Urination problems such as leaking or difficulty emptying. All of these can actually be presentations of a peripheral neuropathy that's caused by cancer or cancer treatment. So if you've had chemotherapy treatments or radiation treatments or other treatments for cancer and you have numbness and tingling or weakness or some of those kind of things, it is valuable to be evaluated for peripheral neuropathy and possibly get treatments so you can get some of that function back to those nerves, and it is possible. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 234 or 324, cancer-induced peripheral neuropathy. Thank you, and have a great rest of your day.